everyone, my name is Summer. Welcome back to another video. So this is week 4. One of the questions was explain what a psychological assessment is related to varying forms. So a psychological assessment is reliable and validating. You can do it's like measures of how they're doing, the epidemiology, their psychological interview, where you ask questions that are like structured or non-structured. One of them is a SCIN, which is a structured clinical interview for the DSM, so you can give a proper diagnosis. You can ask them questions, and depending on their answers, you follow a chart to kind of give you like a diagnosis. There's also the projective test, which is an unstructured set of responses that a person can give. So that's another one. Then you got a thematic I cannot say this one, I'm sorry, apperception test, where you have them to give you like a story about what is going on with them, and they have to give you a beginning, a middle, and an end, and you can pull things from that to kind of get like what they're saying about what's going on. The next one says, what are some of the steps that you should take to assess your client? Well, some of them would be the objective test, which is a specific kind of like response that a client can give you. There's also the Minnesota Multiphasic Personality Test, and that consists of 567 true or false questions. And at the end, the score is printed out, giving you their rating with the severity or the strengths of their situation, things like anxiety, depression, masculinity, femininity, things like that, like stated in the video that we watched. There's the state trait anxiety inventory, which is 40 questions, but it only rates it from like 1 to 4. So you can get a score at the end of that reflects like the state of their anxiety or the trait of their anxiety. So that is some things you can do for an assessment. Some ethical issues that may arise is the next question. So there's things like deception, like not telling your client the full aim of the whole study that you're giving them. There's consent, which we all know what that is. You want to make sure you get an informed consent from them, that they're consenting to treatment or to the test or whatever you're giving them, and giving them the option to not do it. You got confidentiality. You want to let them know that they're not going to have their name be given out. They're not going to be identified or talk. You want to tell them also not to be talking about their performance. Then there's also psychological and physical harm. You want to avoid tasks that might induce like unpleasant emotions. Then there's like debriefing. You want to give them the opportunity to ask questions, and also give them results of their studies. And you also want to make sure that you give them a right to withdraw if they want to where they don't have, let them know that they don't have to continue on if they don't feel comfortable. So that's another thing. And you also need to let them know if there is a chance for them to, that they may receive physical harm. It's important that we also let them know that as well. So you want to make sure that your client understands what's going on, that all their stuff is going to remain confident. If there is a chance for harm, that they may be harmed or could be physically harmed, you want to let them know that. You want to get a consent where they're consenting to do these tests or, whatever. You want to let them know that's going to remain confidential. You want to let them know that give them time to kind of debrief and ask questions and everything like that. So that is my video. I hope you guys enjoyed it. Thank you so much.